Hello, I'm Daniel Weber. I'd like to talk to you about autoimmune diseases. It's a condition which is rampant in the world. Um, Although the numbers are small for individual ones, there are over 120 different kinds of autoimmune diseases. And the difficulty also is that there is no real funding for this. There's cancer, which of course is a popular disease for funding. It receives 2.5 times as much money as autoimmune disease, and yet autoimmune diseases are more crippling for people than cancer. People don't necessarily die of autoimmune diseases as they do with cancer, perhaps, but most people with cancer, especially in the early stages, are quite healthy. With autoimmune diseases, because of their complexity, they're often misdiagnosed for decades, and by the time there is a diagnosis, and it's sometimes very difficult to diagnose these, it's often too late. Somebody is suffering and they're then going on to methotrexate or various kinds of resections, steroidal drugs, and so forth. The medical profession still persists in the myth that this is a genetic disease. While there is, like cancer, a component of a genetic disease, the genetic component in this, it is not specifically, there is a genetic proclivity, and there have to be secondary factors. For example, with celiac disease, we found in the last 20 years, the number of reported cases has doubled. If it were purely genetic, that doesn't happen that quickly. So there has to be secondary factors. And we look at those secondary factors, they're often the same ones that we find in cancer. That is, it is a disease of dysregulation of the immune system. They are opposite in many ways, but they still have the same kind of etiology. What causes an autoimmune disease? Nobody knows. What causes cancer? Nobody knows. We know there are environmental factors, smoking, drinking too much alcohol, bad food, all of these things led to cancer. But with autoimmune disease, it's less driven by dietary factors and more secondary environmental factors. For example, often autoimmune diseases are initiated by a viral infection. This then contributes to an immune overreaction. We know that women, for example, with MS, there's a 7-to-1 ratio of that. There are endocrine issues in it. For example, women with high levels of estrogen are more likely to have autoimmune disease than men. Then we look deeper. There is also the same thing with cancer. There are these inflammatory factors. So we have to have a genetic predisposition, perhaps a viral or bacterial infection. For example, there's some evidence suggesting that Lyme's disease can lead to a variety of different kinds of autoimmune diseases. And last, there's the gut. In both cases, and particularly with autoimmune disease, the loss of tight junction is one of the most convincing factors in the development of that. So we have these various factors, and there are probably many, many more. Social relationships, depression, mood disorders, all of these things are association with the development, the initiation, and the progression in autoimmune disease. And lastly, I just want to say that one of the things that's very interesting in looking at the immune system, in cancer, cell-mediated immunity is often very low, and human immunity is high. But in autoimmune disease, it's the opposite, particularly in some of them, not all of them, but particularly some of them, like RA. The T helper 1, the cell-mediated immunity, is very high, and T helper 2, human immunity, is very low. T helper 17 is also very high. So one of the things that we look at in terms of treatment is not just specifically the disease, but rather the factors that give rise to those kinds of things. Leaky gut, some kind of pathogenic factor that may still remain in the body, the virus, the chronic inflammatory factors, emotional stress factors. You know, it was interesting to me that I had a patient a number of years ago who was very hardworking, a lawyer, worked 70 hours a week and all of those sort of things, always had gut issues, but nothing was out of the ordinary when you recognize somebody who is that kind of stressed and rushed. But a particular emotional event set off an acute celiac reaction. He now has been diagnosed with celiac disease. Now, the issue has always been there, but just that kind of stressor tripped it over into full-blown disease. Emotional stress is a very key component in a lot of autoimmune diseases. And in finishing, I want to say, if somebody has an autoimmune disease, they likely have more than one. These kinds of multiples of autoimmune disease are not generally recognized in Western biomedicine, although the research supports that. It's just that there are no treatments in Western medicine for most autoimmune diseases, except for, as I said, methotrexate, suppress the immune system, resection, cut out parts of the organ, all of these kinds of palliative things, which don't. Coming back to the comparison to cancer, people with autoimmune diseases suffer from day one of that. Type 1 diabetes, Crohn's disease, celiac disease. All of these things have very large impacts on a person's life. A person in stage 1 or stage 2 cancer, they come and they say, I feel perfectly healthy. And they are, except for the development of the tumor. But in autoimmune disease, the impact of that, while it may not be a terminal condition, it does impact their daily life in a much greater fashion than cancer. We don't fund research in autoimmune disease because there's no interest, because there's no solution. Cancer gets all the money, autoimmune disease gets none. So what I've done is I reviewed all the literature for the last, since 7-8 months now, looking at all the literature on the issues and finding pathways, both directly and indirectly, to work with various kinds of autoimmune diseases. I picked the top 22 most common ones, the ones that are affecting maybe 5 out of 1,000 people as opposed to 1 out of 1,000,000. And we're going to focus on that and we're going to look at that. And in finishing, I want to talk about tight junction. There's a protein called zonulin. When released, opens up the gut. And there are herbal substances, botanical substances, that actually support tight junction function. This in itself begins to bring in relief to the patients who suffer from these varieties of autoimmune diseases. Thank you. I'm Daniel Weber. I hope to see you when you come to my seminar.